Hello, everybody. This is Gary. Today is Monday, February 27th. It's 2023. It's 4:24 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, I'm not doing as bad as I was yesterday. Yesterday, my paranoia was really bad. My anxiety levels were very high. I was very agitated for a lot of different reasons. My auditory hallucinations were kind of intense. Paranoia and delusions was kind of getting out of control. Anxiety levels were very high. But I'm doing better today. I went out for my physical therapy and walking exercises. My right knee still hurts after surgery from May 13th of last year. Um, I had torn meniscus that they removed out of my knee, and the soreness tends to get worse in the winter. Um, of course, I still have pulmonary fibrosis. We're not sure what caused that. It's usually a chemical irritant of some kind that either used to happen or is ongoing. The only thing that I could think of that caused it was me using too much Clorox to clean my apartment and breathing the vapors in accidentally. Because pulmonary fibrosis is when scar tissue forms in the air sacs of the lungs, making it more difficult to breathe, and I get out of breath, even if I'm just going for a regular walk. It's even more difficult to walk up and down stairs. I live in an apartment building that's 22 stories high. I live on the fourth floor. If I have to take the stairs, and sometimes I do because the elevators don't work, I will walk up the stairs and I'll be very, very out of breath by the time I get up to the fourth floor. Um, so we're not sure how bad the pulmonary fibrosis is or how advanced the scarring in my lungs is. It's not cancer and it's not emphysema, um, but it does interfere with the ability to breathe. Um, I won't know anything until I see the pulmonary specialist on March 28th. They'll run some tests and I'll consult with the specialist and see what's going on. But in the meantime, I'm just taking it day by day, trying to stick to my daily schedule, make sure that I take my medications, make sure that I have all my medical appointments, keep those. I just had a phone consultation with my gastroenterologist. We scheduled a endoscopy for next Friday, not of this week, but next week. What that basically means is they're just going to stick a camera down my throat and look at my mouth, my throat, my esophagus, into my stomach. They just want to see why I keep getting food lodged in my esophagus, not high enough where it interferes with my breathing, but like right in the sternum of my chest, food gets stuck. Part of it might be that I'm not always properly chewing my food. Um, but this has happened before in the past. I've had constriction in my esophagus before, and they've had to dilate my esophagus while doing the endoscopy. Um, so they'll take a camera, look down my throat, see what happens, see if there's anything that needs to be dilated. If there's a constrictor in my esophagus that keeps me from swallowing food, they might be able to dilate my esophagus during the endoscopy. I was always having difficulty swallowing food when I first started on Seroquel 10, 15 years ago. Seroquel can interfere with the operation of the smooth muscles in the esophagus, making it more difficult to swallow. Luckily, I'm able to swallow my medications and liquids generally just fine. It's only solid foods that tend to get lodged in my esophagus. And I blame that on the Seroquel. But I can't stop taking the Seroquel because it's been the most effective medication I've ever taken for my schizoaffective disorder, both as an antipsychotic and as a mood stabilizer. I'm still taking Zyprexa twice a day for the paranoia and the hallucinations. I usually take it with the Klonopin because it's better. Both medications are more effective when I take them together. Um, And as far as today, my psychiatric symptoms aren't all that bad. My auditory hallucinations are at a minimum. My paranoia is not that bad. My delusions are not that bad. My depression is not that bad. My anxiety is not that bad. Um, Today is Monday. I believe on Wednesday I have an appointment with my therapist. And the day right after that, Friday, I have an appointment with my psychiatrist. And we'll just go over all my meds. I don't think we're planning on changing anything as far as my psychiatric meds are concerned. Um, the only recent changes in my medication was when my primary care doctor added another blood pressure medication. So I'm on 3 separate high blood pressure medications. Of course, it would be better if I controlled my diet and lowered my blood cholesterol and sugar. My blood pressure would probably go down naturally, which is what I'm trying to do. Um, I am pre diabetic, not quite diabetic, and I'm certainly overweight by about 30 pounds. Um, and my blood cholesterol is too high. My primary care wants me to control my blood sugar and my blood cholesterol through diet, not through medications. I'm already on a long list of medications. Um, so they didn't want to add anything to an already long list of medications unless they had to. I do have a blood pressure cuff, so my blood pressure hasn't been that high since I started the new blood pressure medication. When my last time I got evaluated for my blood pressure, it was 177 over 99, which is very high. Now it's back down to around 128 over 78. Um, so there's not much else to report on. My psychiatric symptoms aren't that bad today, and I do have appointments coming up. Like, comment, share, subscribe.